Typically, I would treat most patients kind of start out the same way. I have a set of parameters I start with, and I pretty much start there. I also tell patients when I first see them that it takes time for the body to kind of accept the energy and to start rebuilding and repairing that damaged tissue. I tell them also that most people will start to see or change within 6 treatments, 7 treatments. If they're not seeing anything after 8 or 10 treatments, 12 treatments, it's probably not working. There's something else going on that we've missed, or we're not kind of treating the right area and stuff. So I now know that I've got that window that I need to get some change. Any change, no matter what it is, but I need to find some kind of change. Another thing I ask patients when they first come in is, kind of what's going on in their life. How are they sleeping at night? If they have a disturbed sleep, you just mark that down and make a mental note of that. Kind of what other things they do, what they're doing in their life. They used to do a lot of gardening and they've pulled back from that because they're in pain. Sometimes you have to remind the patient that they're doing better. So after 4 or 5 treatments, they come in and still say, "Oh, I'm still in pain." But then you start asking, "Well, how are you sleeping at night?" "Oh, I slept very good last night." Okay, so we know something's going on, change. So now we start showing that they're getting change, they're more apt to keep coming back.